Right. Hi, this is Dr. Paul Goldberg of the Goldberg Clinic. We're here at our retreat center in Brooks, Georgia today, and very pleased to have Michelle Bolin with us today from Liberty Hill, Texas, right?
Yes, sir.
That's right, which is near Austin?
Yes.
Yeah. And Michelle has, this is a return visit. She came and saw us originally in July of this year. It's 2016. And she's returned today a few months later. We did a workup, we did a physical exam, case history, laboratory studies, got Michelle on the program, and originally, Michelle, you came here because of what?
Joint and muscle pains.
Tell us about the joint and muscle pains. How severe were they? How did they affect you?
It affected every part of my life. Sleeping, working, getting dressed, showering, everything. Every part of my life. Bending down, reaching up, going in the kitchen, everything.
How long had you been having those pains for?
From the end of April until I came and saw you in July.
Okay. And was it fairly unrelenting at that time? Were you having it did you have times where it didn't hurt you at all, or was it always there?
It was always there. It was worse at night.
It was worse at night. Okay.
Yes.
And what had you done about that before you came to see us? You went to see a rheumatologist?
I went and saw a rheumatologist, got a whole bunch of x-rays and blood tests done. I did not want to go the drug route, so I started Googling for a way to figure out the cause of this. Okay. And I found you. Mm-hmm.
Well, rheumatology is a field which is pretty narrow in their approach, and this is a pharmaceutical approach, and most of our patients, in fact all of our patients that see rheumatologists either end up on corticosteroids or some type of immunosuppressant drug. We don't feel that that's a good route to get back to health again. And did we tell you we were going to treat your joint pains?
No, we were going to treat the cause of what the inflammation
We were going to look for what was causing that inflammation and get you better by getting you healthy.
Exactly.
Right?
Yes.
All right, so here we are about 4 months later, and what's been the result?
Oh my gosh. Life is great.
We like to hear life is great.
Life is great. It's less stressful. I'm in so much less pain. I mean, like, from 100%, I'm like 90%.
You're 90%, but you only have, even in just this short period of time,
yes.
4 months, you only have about a 10% residual right now.
Yes.
And one of the ways we know that we can document that, like with other patients, is there's two big parameters of inflammation that we use as lab tests. One is called a CRP, which is a cardiac reactive protein measure, and the other one is a SED rate, or a sedimentation rate. And they're both measuring levels of inflammation. They measure it a little differently, but they're both measuring inflammation. And looking at your chart here, you originally had a cardiac reactive protein, a CRP, of 5.12, which is quite high. And what is it now?
I believe it's 3?
0.5.
0.5.
0.5.
Okay.
Yeah.
Big difference.
Okay. Actually, no. Is it point? Dr. Tenner's 0.3.
0.3.
I'm mistaken. It's not 0.5. It's 0.3. That's from when Michelle originally came in from a 5.12. So we're looking at only a fraction of what it was before. And by the way, now it's entirely normal range. It's actually a very healthy one. And the other measure, which is a sedimentation rate, was originally on you, Michelle, was 102. And today is now about a third of that. It's at 34. And we're going to work on getting that down a little bit more, because we're not happy here still being 10% of the pain. We want to get that closer to 0. So as I explained to Michelle, there's still some work to do, but she's enjoying life. Now look at the smile. We like to see the smile.
Life is good.
And she can have better energy, more activity. By the way, what's happening with your digestion and your bowels? Have those changed at all?
Oh yeah. I mean, before, I suffered with constipation, and now it's regular. Might I say, better flow of it's just regular, and it feels good.
It feels good.
You expect it.
And
it bothers you if it doesn't happen right away.
Absolutely. And that's just a sign, again, we didn't treat her bowels, we didn't treat her joints, we didn't treat her energy. We just did all the things that were necessary based upon examination, lab work, and physical exam that we found needed to be approached and create the right conditions of good health. And there's the outcome. All right, so we're going to keep working on this, and you're not going to be dependent on us for very much longer because you've learned the things you need to do and you're going to carry them forth in your own life.
That's right.
All right. Thank you, Michelle.
You're
Appreciate
welcome.
it.
Thank you.